Degenerative disc disease is a condition that is commonly misunderstood. A degenerated disc is not actually a disease. It is a normal aging process of the spine. It's not considered a disease because degenerative changes in the spine are natural and common in the general population. When a disc degenerates, it loses its ability to function efficiently as part of the spinal joint, which in turn can lead to back pain, possibly pain that radiates through the extremities. Oftentimes, degenerative discs do not cause any pain or any other symptoms, but as the discs degenerate, the possibility of these problems become greater. There is a disc between each of the vertebrae in the spine. The discs of the spine cushion the interlocking vertebrae and act as shock absorbers for the back, allowing it to bend, flex, and twist. Intervertebral discs are composed of two layers, a tough, firm outer layer called annulus fibrosus and a jelly-like inner layer called the nucleus pulposus. A healthy, well-hydrated disc will contain a great deal of water within its nucleus pulposus, which provides cushion and flexibility for the spine. Mechanical stress that is caused by everyday movements is transferred to the disc, and the water content within them allows them to efficiently absorb shock. Normally, the nucleus pulposus contains about 80% water, and with age, discs will lose water and become more narrow, less flexible, and less effective as shock absorbers. Because discs heal slowly, new nerve endings can develop within the narrowed intervertebral space and cause pain. Natural daily stresses and minor injuries can cause the annulus fibrosus to weaken, which results in the disc gradually losing water. This loss of water reduces the disc's flexibility and results in the gradual collapse and narrowing between each vertebrae. As the space between each vertebrae gets smaller, extra pressure can be placed on the disc, causing tiny cracks or tears to appear in the annulus. If enough pressure is exerted, it is possible for the nucleus pulposus material to seep out through the tears in the annulus and cause what is known as a herniated disc. As disc material or cartilage in between the bones of the spine breaks down, extra movement occurs in the joints of the spine. The body can react to closing the gap between vertebrae by creating bone spurs around the disc space in an attempt to stop the excess motion. Bone spurs are smooth growths that do not always cause pain, but likely will cause pain when they form in the foramen where the nerve roots exit the spine. This can cause issues if the bone spurs start to grow into the spinal canal and put pressure on the spinal cord and surrounding nerve roots, as it can cause pain and affect the nerve function. This is a condition called spinal stenosis.
Patients with degenerative disc disease may experience a wide range of symptoms. One of the main symptoms that patients will experience is pain. Degenerative disc disease can cause a wide variance of pain from patient to patient. There are a lot of factors that can contribute to the amount of pain a patient experiences. Like, what vertebrae affected, how many vertebrae are affected, and how long the patient has been suffering from the disease. Some activities might exacerbate the pain the patient feels, like bending, twisting, and even sitting down. A lot of patients with DDD prefer standing over sitting because it puts less stress on the impacted vertebrae. Part of the problem doctors face who treat DDD is that the pain varies so much from patient to patient. It is hard to manage the pain the patient is experiencing. So it's very important to work closely with your doctor to get the right amount of pain medication to overcome your symptoms. Some patients may experience so much pain that they're unable to walk.
Weight can be a big factor contributing to the amount of pain a DDD patient is experiencing.
The reason weight is such a big factor in DDD is because it will put further stress on the degenerating discs. It may become the doctor's priority to decrease the patient's weight to decrease the amount of stress they're putting on their discs. The doctor will most likely recommend dieting to lose weight than exercise because exercising can further damage the discs. Patients with degenerative disc disease can experience other symptoms than just pain. Patients can experience numbness and tingling in their extremities. Patients say the numbness and tingling kind of feels like pins and needles. Patients may experience weakness in their arms and legs. This feeling of weakness may make daily tasks difficult. This feeling of numbness and weakness is usually caused by a pinched nerve. Patients might also experience a limited range of motion, caused by swelling or fusing of vertebrae. Patients might experience some normal daily tasks becoming unmanageable from experiencing some or all of these symptoms. Patients might experience flare-ups of symptoms, so they might go days or weeks without experiencing much pain, and then one day they're in an unmanageable amount of pain. Degenerative disc disease can either cause pain from inflammation or further damage to the disc itself. Either through normal progression of DDD or injury, the outer layer of the disc can get damaged. This damage to the outer layer of the disc can cause protein to leak out of the inner layer of the disc. The protein that leaks out of the disc will actually irritate nearby nerves, causing the patient to experience pain. Degenerative disc disease causes the space between the vertebral bodies to shrink. So, since the space that the nerve runs through is smaller and inflamed, that can lead to the nerve getting pressure put on it, which is called a pinched nerve. A pinched nerve can cause numbness, tingling, and pain. In degenerative disc disease, the disc doesn't always degrade in the same proportions on each side. This can cause the spine's alignment to be thrown off. The patient might experience further pain caused by the alignment of their spine being disrupted. There are many different causes for degenerative disc disease. Degenerative disc disease can be caused by a lifestyle that involves hard labor and repetitive motion. Degenerative disc disease can also be caused by a severe injury to the disc itself. Degenerative disc disease also can be hereditary, meaning if your parents have degenerative disc disease, you might have a slightly higher chance of developing it. Degenerative disc disease is also just a normal part of aging. Patients with degenerative disc disease have a higher chance of developing bulging discs and herniated discs. So what are herniated and bulging discs? And why are patients with degenerative disc disease at a higher risk of developing them? Degenerative disc disease causes the integrity of the disc itself to be compromised. This will increase the patient's chances of getting a herniated or bulging disc. A bulging disc is when the outer layer is damaged and the pressure of the spine pushes the inner layer out. The outer layer of the disc is still intact, but the inner layer is pushing out the outer layer, causing pressure on the spine. This pushing on the nerves in the spine itself causes the symptoms of pain, numbness, and tingling. Patients will normally develop bulging discs in the lumbar spine. The main difference between a herniated disc and a bulging disc is the outer layer is actually completely torn with a herniated disc. So the inner layer itself is actually pushing against the spine and the nerves. Herniated disc can occur anywhere in the spine, but most likely will occur in the lower back or lumbar region of the spine. The main symptom of a herniated disc is either pain in the back around the herniated disc or numbness in one or both the legs. Visualizing what happens during a herniated disc. The red arrow represents the pressure that is placed on the vertebrae. You can see that the pressure that is placed on the vertebrae causes the intervertebral disc to squish out or be pushed out. When treating a disc injury like a herniated disc or a bulging disc, the patient will first start off with just some minor painkillers and anti-inflammatories. The doctor first will try to give the body time to heal itself before intervening too much. The anti-inflammatories and pain pills the patient is given is supposed to help alleviate symptoms while giving the body time to heal. If the patient is still experiencing pain after about 6 weeks, then the doctor will move on to the next step. The next step would be to administer corticosteroid shots into the affected discs. The corticosteroid shot will decrease the swelling, which will help alleviate some of the pain that the patient is experiencing. The disc is still damaged, so it's important to take it easy after the corticosteroid shot because it hasn't eliminated the reason the pain has started. The doctor may suggest for the patient to start undergoing physical therapy. If other methods are not alleviating the pain and other symptoms the patient is experiencing, the doctor may suggest surgical options. The most common surgery used to treat a herniated or bulging disc is a microdiscectomy. A microdiscectomy requires a small incision to be made. The small incision is made so the doctor can reach the affected disc. The part of the disc that is herniated or bulged out will be removed. Recovery time for a microdiscectomy usually is 3 to 4 days, but can sometimes take up to a couple weeks.
Degenerative spondylolisthesis is a condition where the facet joints of the lumbar spine weaken, which results in a vertebrae slipping forward over the one below it. Degenerative spondylolisthesis occurs most frequently at the L4, L5, or the L3, L4 junction of the lumbar spine. Although it can occur at any level, it is rarely seen in the cervical spine.
What are other conditions that are associated with degenerative disc disease? Spinal stenosis is one of those conditions. Well, to better understand it, let's break it down. Spinal, having to do with the spinal cord and spinal canal, and stenosis, or a narrowing. This is a common condition that occurs when the spinal canal, usually in the lumbar region, which contains the nerve roots and the spinal cord, becomes compressed. This can cause a pinching of the spinal cord and/or nerve roots. This can lead to pain, cramping, weakness, numbness, and/or tingling. Some people with spinal stenosis may not show any symptoms. Others may experience extreme pain, tingling, numbness, and muscle weakness. Symptoms of spinal stenosis can worsen over time. Spinal stenosis is the outcome of anything that has to do with degenerative disc disease. Bulging and herniated discs are usually the main culprit. Spinal stenosis can happen in any part of the spinal canal, but is usually localized to the cervical spine and lumbar spine. If you're experiencing symptoms of spinal stenosis, your doctor will probably start by taking a medical history. After that, he will perform a physical exam and observe your movements. Usually, range of motion in the lumbar region is greatly affected by spinal stenosis. Your doctor may also order tests to confirm a suspected diagnosis. These tests can include an X-ray, MRI scan, or a CT scan of your spine. As you can see on the MRI on the right-hand side, the top disc, being the normal disc, is not encroaching on the spinal canal at all. The second disc, which is slightly degenerated, is starting to encroach into the spinal canal. And the third disc, which is completely herniated, is pressing onto the spinal cord and/or nerves. This can cause massive discomfort and pain, possibly tingling in the legs. The image on the left-hand side is a good representation of what spinal stenosis would look like in the cervical spine. As you can see, all of the discs are degenerated in the middle of the cervical spine and are pressing on the spinal cord. Treatments for degenerative disc disease can include any of the following: occupational therapy, physical therapy, or both at the same time, along with special exercises, medications, losing weight, and possibly surgery. More medical options include injecting the joints next to the damaged discs with steroids and local anesthetics. These are called facet joint injections, and they can provide effective pain relief for a period of time. Facet joint injections are a minimally invasive procedure in which a physician will inject a small amount of local anesthetic and/or medication in order to numb the facet joint and provide pain relief. Fluoroscopy is used to guide the placement of the needle into the facet joint. Facet rhizotomy is a radiofrequency current that deadens the nerves around the facet joint. This prevents pain signals from reaching the brain. Patients who respond well to facet joint injections may benefit from these. Pain relief may last for more than a year, which is most of the time longer than the facet joint injections. The surgical treatment is also an option in cases of severe debilitating lumbar degenerative disc disease. This is only recommended after at least 6 months of non-surgical treatment. This is usually physical therapy and trying to lose weight. Most cases of severe degenerative disc disease can be managed by non-surgical methods and do not require surgery for effective pain relief. Spinal fusion surgeries can differ in how the procedure is approached, and the methods or tools used to fuse the joint based on where the degeneration is happening. The affected spinal disc is entirely removed from the disc space. This is referred to as a discectomy. The setup for fusion is put in place, which may consist of a bone graft and/or instruments that further stabilize the spine, such as implants, plates, rods, and/or screws attached to the vertebrae being fused. After the excision of the degenerated disc, the vertebrae will be fitted with the proper hardware. The vertebrae then grow together, changing the joint into a solid, immobile structure. Fusion happens in the months following the procedure, but not during the surgery itself. What you are seeing in this video is a cervical spine discectomy for a C-spine fusion. This is where they remove the intervertebral disc and put in a graft and immobilize the disc space with hardware. In this video, we see the surgeon placing the mounting hardware for the lumbar spine fusion. They have already removed the degenerated disc and are implanting the hardware for the immobilization before putting in the graft between the vertebrae. After the graft is in place, they will install the rest of the hardware for the immobilization of the joint. Based on the severity of the degeneration, degenerative disc disease can, in most cases, be managed with non-surgical means. This is a lifelong condition though, as the discs will not regenerate. Adhering to a strict regimen of medication and doctor's visits will be the most important part of pain management with degenerative disc disease. Losing weight will also help with pain management because not having the weight pulling forward on the degenerated disc will provide pain relief. Thank you for watching our video. Annie put a lot of time and hard work into it, so be sure to tell her that she did awesome. Hopefully you don't encounter the pain that degenerative disc disorder brings, and if you do, I hope this video was educational.